when will we get vaccinations? No one was looking at hospitals, no one was looking at doctors or teachers, only the researchers, that when will they um, do trials and provide us the vaccinations. So every new thing, every new intervention, every treatment, every protocol needs research. So research is the foundation of clinical world. Now how you start research? Before starting research, you have to, I'm sharing my screen with you guys. Let me share my screen. Okay, so before starting research, you should get a clear idea about the type of research. So basically, there are two major types of researches. One is experimental research, and the second one is observational research. And the second one is okay. So now listen closely, and this is very important in your literature review and your review article. Every literature, like for research, you need literature review, and if you don't know the types of research, then you cannot do literature review. So listen closely and listen carefully. The first one is experimental research, and the second one is observational research. Now, what is experimental research? Experimental research is basically trial. You are doing intervention, you are doing a trial. For example, I have a population of 100 people, and I want to do research on them. Like they are diabetic patients, and I don't know what is the drug of choice for diabetes. So I want to do research on them. Now, what will I do? I'll randomize these patients into two groups: 50 patients in group A, 50 patients in group B, and I'll treat 50 patients with a drug that I have in my mind, that I have predicted that this drug can work in diabetes. I have no confirmation, I have no theory that this drug has efficacy in diabetes. I have just predicted. I have just predicted through its mechanism of action. Now I want to test it and I want to confirm it. So what I do is first divide the population of 100 people into two groups, group A and group B. Group A is test and group B is control. Now I'll give my drug, the drug that I have in my mind, the drug that has efficacy in my mind, but not in practical world. I'll give this drug to group A, the test one, and I'll give a placebo to group B. Placebo is drug without any effect. Like it can be a chocolate or a toffee in a capsule. The patient don't know that they are receiving a placebo or receiving a drug. So I'll be giving the placebo to group B and the drug to group A, and I'll be observing them throughout, like for 6 months or for a year or for 2 years. That depends upon the follow-up of my study. Then after some time, I'll observe any outcomes in group A versus group B. I'll check their insulin level, I'll check their HbA1c level, and note any difference between group A and group B. If the drug that in my mind, for example, the drug A, the drug that I had predicted has efficacy in diabetes, and I had given that drug to the group A, and that drug has really efficacy in the practical world. Then what that drug will do to the patient, it will decrease their glucose level and it will increase their insulin level. Like treating the diabetes basically, and the placebo will have um, same outcomes as before. No any like a notable difference before and after the follow up. So I'll conclude that yes, the drug that I had predicted has efficacy in diabetes. This is a trial. This is experimental study. But what is observational study? In observational study, we do not do any intervention. It's just observing the patients throughout the time or through snapshot. No intervention. And it has further two types. A, snapshot study, and B, follow-up study. Okay, so what is snapshot study and what is follow-up study? Snapshot study is basically taking snapshot in a close time, in a certain period. Not period, I would say, taking snapshot in a brief time. Like there is a population in a district of in district Jhelum. There is population. The monkeypox race cases are higher in Jhelum, and I want to do research on that population. I'll go to Jhelum, district Jhelum, and I'll observe the population. I'll distribute a questionnaire and I'll collect the data. Then I came back to Lahore and analyze the data. This is a snapshot study. I did not follow up the population throughout a time, throughout a course or throughout a period. I just did a snapshot, just took their data through a questionnaire and then came back and analyzed the data and then wrote the manuscript of that data. This is a snapshot study. And snapshot study is what? Cross-sectional study. Okay. What is follow-up study? Follow-up study is basically observational study, but it has some follow-up. You are observing a population throughout a period, throughout a follow-up. Like there's a population in Islamabad, and in Islamabad they have higher risk of coronary heart diseases. So what I do is observe the population of Islamabad throughout an year or 5 years or 10 years. That depends on my follow-up. And note any difference. Like, for example, there are further two types of follow-up study. Let me classify it. One is cohort study, and the second one is retrospective study. Okay, so what is cohort study? In cohort study, it's a follow-up study basically. In cohort study, we have the exposures. The outcomes are not available yet. For example, there are higher cases of obesity in Islamabad. And as a team of researcher, I go to Islamabad and I make a cohort, a population. Cohort is basically a population that have same characteristics in their genetics and age and gender and race, everything. Okay, so I make a cohort, a population, and I start observing them for like 5 years. Now, there is exposure. Exposure mean they are exposed to processed foods, they are not doing any exercise, they have sedentary lifestyle. These are the exposures. And through this exposure, I follow them for like 5 years and then see any outcome after 5 years. After 5 years, I note that there certain like prevalence of obesity in my cohort because they had sedentary lifestyle. They used processed food. They do not do any exercise or any other workouts. So this is a cohort study. I started from exposure and follow them till the outcome, till the obesity. This is a cohort study. Now, what is difference between cohort study and experimental research, experimental study? Experimental study, I was following the population, but I was giving intervention at the same time. But in cohort study, I just following them, but I'm not giving any intervention to them. I'm not giving any drug or placebo to them. I'm just observing them. That's it. That's the difference. Now, what is retrospective study? Retrospective study is also a type of observational follow-up study, but it's different from cohort study. And in retrospective study, I have outcomes and I go back in time and see the population and see their exposure back in time. Like, for example, I visit old Lahore, I visit a factory, an industry, and that industry there are higher cases of bladder cancer, bladder carcinoma, transitional cell carcinoma. Now, this is an outcome. The patient has already developed the outcome, the transitional cell carcinoma. Now, I go back in time, I go back in history like 5 years or 10 years, and through that back history, I collect all their information, their exposure, their lifestyle, their diet, and everything. And I know that the the workers that were working in aromatic hydrocarbons industry were more likely to develop transitional cell carcinoma as compared to other workers. This is a retrospective study. I have the outcomes. I go back in time to the exposure, then followed them through a time, through a period, and then see the outcomes. This is a retrospective study. Okay, so we already covered the. Oh, I should admit all of these. I just forgot to admit them. Okay, guys, I'm sorry for all those who joined late. We just covered the types of researchers. These are, I'll just. Mm-hmm. Okay, yes. Okay, guys, you can raise your hand whenever you have any query, any ambiguity in your minds, and I and Saad are here to answer you guys. Also, I covered these. These are basically the types of research for those who joined late. Basically, there are two types of researches. One is experimental research, in which we do trials, we do intervention, and the second one is observational research. We do not do any intervention. We just observe the population. There are further two types of observational research. One is snapshot study or cross-section study, in which we observe a population in a snapshot. We do not do any follow-up or any observing them throughout a period. It's just a snapshot. The second one is follow-up study. And follow-up study, we observe a population. And there are further two types of follow-up study. One is cohort study, in which the outcomes are not developed yet. It's just the exposure that you are observing, and then you are observing the exposure throughout a time for like 1 year or 5 years or 10 years. And then when the population develop outcomes, your research completes. That's a cohort study. And the second one is retrospective study. The patient had already developed an outcome. You go back in time. You observe their exposure, their lifestyle, all their genetics, and then through time you follow them and like till the outcome develop. That's basically the types of researches. Now, where you can start, like when you are at zero, where you can start, I'll suggest to start from, always start from letter. Letter mean writing something to the editor, like something concerning something public health concern, some bias or anything concerning clinical research, and you're writing a letter to the editor of the journal. This is letter. Now, how do you write a letter? There are two types of letter basically. One is letter to the editor, we call it LTE, and the second one is critique writing. Okay, so these days publishing LTE is very tough, so I'll always suggest to write LTE. Now, what are the benefits of writing LTE? The benefits of writing LTE are a lot. Like you learn how to search on PubMed, you learn how to do literature review, you learn how to cite, how to do referencing, how to do citations, how to submit to a journal. These are all the basic things that you learn through critique writing. First, learn the critique writing. We have already shared the link of critique writing. We have uploaded the recording on our YouTube channel. We will share again. Learn the critique writing, and then you can select any one of these for undergrads: cross-sectional study, case reports, cohort study, retrospective study. These are the other types of researches. And also we have other studies like meta-analysis, systematic reviews. I'll share a pyramid with you guys after some time. You can have a brief idea about those as well. But always, if you are at zero, start with critique writing. Now, I am answering to some chats or some queries. Like I'll get a brief idea of um, am I guiding you guys correctly, um, from zero, from scratch, or I have to dig more into basics. So I'm here to answer you guys through chat, or you can unmute yourself and ask a question if you have any in your minds. Sir, can you please how to write an LTE? Laiba, LT, I have already recorded a webinar on LTE. You can visit our YouTube channel. We have shared the link. I'll share the link again. You can visit our YouTube channel, and you can have a brief idea. It's like almost a hard long webinar. You can have a brief idea about critique writing, and then you can start writing critique. No, this is like you're not targeting them in a negative way. First, you appreciate, like Saad has a study published in a journal, and I read the study. What I'll do in my critique is, first of all, appreciate Saad. Saad is contributing to our clinical world. Saad is doing something great. I'll appreciate Saad that Saad, you have done a very good job. But there are some gaps in your study. No one is perfect. Not even a single human is perfect. There are some gaps in your study, and I want to highlight these gaps. And for future researches, these gaps should be covered. This is the aim of a critique. You are also contributing to your uh, clinical medicine, to research through critique writing, because you are suggesting something. You are directing the research gaps that should be covered in the upcoming literatures and the upcoming studies. So there's nothing negative about a critique. There are always positive aspects of writing a critique or LT. Critique will count as publication, of course, Hassan. It's a publication. I have like 8 to 9 publications of critique and LT is Sana. Okay. Is it too early for first year MBBS to start research? No. I have my friend Shazib. He got published 3 articles in before MCAT, like in FSC. His elder brother was doing research. His elder brother was in third year or fourth year, and Shazib, my friend, was in FSC, and Shazib got some acceptance in FSC. This is never too late, never too early. Research is never too late, never too early. Like if you already graduated and like you're thinking that it's too late for me to start research, no, it's never too late. It's never too late. It's never too early. Start whenever possible for you guys. But I suggest to start as soon as possible. For me, if I go back in time and I get admission in med school, I would have started research straight away from the very first day of my med school. Can you tell a bit how can you search for an appropriate topic for critique? Okay, Nabia Shakil, go to PubMed, go to advanced, select all fields, then click on publication type, then type letter here, add search. Okay, so now these are all the critiques, all the letter to the editors of journals. Then you can find journal of your choice and target that journal. Like for example, you are aiming to write a critique on hematology. So there you go, therapeutic anticoagulation in COVID-19 patient. So what you do is, just copy this journal, open it. Yeah. Now I have a journal, and by opening this journal, I have three things that are clear in my mind. First, this journal is PubMed indexed because I picked it from here. Second one is they accept letters because they have accepted this one. And third, it's hybrid. It supports open access, but it also supports publication close access. Like you can submit without APC charges, subscription, no APC charges. Now, you read an articles and issue, latest issues. Never select a review article. Always go for original article. For example, this is original article. Click on the original article, and efficacy and safety of low molecular weight heparin for venous thromboembolism prophylaxis and abdominal or pelvic cancer surgery. A meta-analysis. Okay, you can write a critique on this. Just okay, so this is a close access. Just copy the link and paste it in IRC group and ask for the PDF. Someone will send you the PDF. Open the PDF and read their methods, their results. Okay, no, this is not a close access. This is yes, this is close access. Okay, so read their methods, read their results, and note any bias. Anything like, for example, it's almost impossible for a meta-analysis not to follow Prisma guidelines. But if there is a meta-analysis and not following Prisma guidelines, you can build an argument. For example, if they have taken 90% confidence interval instead of 95% confidence interval, then you can write a critique on that. You can have a comment on that. And then their sample size is okay, more than okay, I would say. But if, for example, if the sample size was 318 instead of 6,318, then I would have a strong argument to build on, and I would have targeted them that their sample size is not sufficient. So these are the things. When you read the full text article, you can have a clear idea on which variables and which aspects of a study should be targeted and critique. Uh, but always read the methods and results. Also, you can ask ChatGPT. You can upload the study to ChatGPT and ask ChatGPT to recognize or identify any weaknesses or any biasness in the studies, and then write critique on that. Not using ChatGPT, write it on your own hands manually. But yes, ChatGPT can help. ChatGPT can identify the mistakes and the bias. Okay. Can we search PubMed for a rare case and do a critique on? No, never do critique on case report. Mohammed Idris, sir, for beginners, is it necessary to join a mentorship program, or should we build our basic on our own? Idris, up to you, 50-50. But to me, I think the basic things should be covered on yourself. Um, Mentorship is mandatory for complex researches like database studies, um, meta-analysis, network meta-analysis. For the basic type of researches like case reports, LTEs, critique writing, you can literally publish on your own. There's like no need of any mentorship for basic researches, but still it's up to you. Like if you need mentorship, you can have a mentor, and mentor can guide you. But you can do it on yourself as well.
Dr. Iftkhar,
Yes,
uh, can I just share the research pyramid with them for like 10
Ye-
minutes?
yes, you can share.
Yeah, okay, thank you so much. Hello, everyone. So let's talk about research. Research. We'll go quickly. Sorry for the brief pause. We will go over this. So just listen to me carefully, okay? So this is the research pyramid, and you have this like the studies on the animals. This is called a preclinical research. Then we are telling you guys to start from here, the editorials and the commentaries. I'll just confirm again if I am audible. Okay, thank you so much. So, so we are telling you guys to start from here, the editorials and the commentaries. I'll give you the basic idea what are editorials and commentaries, as Dr. Iftikhar has already mentioned a lot. And then you have the case reports, then you have the case series, then you have the case control studies, the cohort studies, the randomized control styles, and then you have the systematic reviews and the meta-analysis. So we are not doing this. The preclinical studies which are done on animals, these are the editorials and the commentaries. So what are editorials or the commentaries? So I want to hear from you guys. Like these are the things that we write to the editors, but who are our target audience? Our target audience are not the is not the editor. Our target audience is the people who will be reading this letter. So we are actually writing to the editor, but our target audience is the reader or the readers of the journal. So we are actually pointing out to a specific we the critique that Dr. Iftikhar was mentioning about. What is it? You actually take out a topic of your interest and you write to the editor. Who are your target audience? Your target audience are the people, are the readers of the journal, and you just tell them about the topic. You just add to the topic. You read their paper, you see that they have not discussed this point, so you just add a 2 3 extra points to their discussion. So this is all about it. So this is very basic and simple. Like like you have to use a total of like 4 references. You should know how to give references. I will teach you in a minute how to give references if there are people who are completely new. So you have to like use 4 references. If you sit down and you start writing, it will take a maximum of like an hour or two. So in 2 hours you can just write a paper and you can get it published, so you'll be like a published author. So that's why we are telling you guys to start writing from the letter to editor, because it's very basic. You can quickly publish it, and you can call yourself a published author. And if you have one published, you can get opportunities for more. If you have two published, you can get opportunities for more. So it's all about, that's why I always tell, never start from meta-analysis, never start from the database studies. Why? Because if you start from them, you'll get distracted and disheartened. uh, okay. So are you guys getting my idea? Can you just write? You're fast. Yeah. Okay. I'll just slow down. No worries. Are you guys getting my idea? You can just type yes. Okay, okay. Thank you so much. Thank you so much for the thumbs up. So that's why we are telling you guys not to go for the meta-analysis, because a meta-analysis, at the very least, it takes like 6 months to get published. So you'll be sitting for 6 months and waiting for your article to get published, and there is no guarantee if it will get published or not. So you'll like say research is not for me because it is not giving me the results, because you're doing it the wrong way. Okay, we will tell you about the topic selection. Okay, just get a brief idea about what telling you guys. So then we will come to the topic selection and everything. Okay, these are the editorials and the commentaries that we are talking about. Then you have the case reports. How do you do a case report? You know what? This is very basic and simple. You can just go and ask your professors in the hospital to give you a case. What is a case report? So it is a unique case, a rare presentation, a rare management that you guys use and you report it. For example, there normally, like take any disease, like there is, for example, there was a case, immune thrombocytopenic purpura. Normally it responds to steroids, normally it responds to intravenous immunoglobulins. There was a patient that I saw in the hospital that did not respond to steroids, that did not respond to intravenous immunoglobulins. The platelet count was like 18,000, then it dropped to like 10,000. The doctors had no option because they had used all the possible therapies. So what did they do? They opted for emergency splenectomy, and that was like a very dangerous thing, because at a platelet count of like 10 or 15,000, you're going for splenectomy. So what is this? This is a rare case to report. Are you guys getting my idea? So this is rare management. This is not something that happens every day and usually. So this is rare. So you get the case and you write a report on it, that this was a very rare case. This was a very rare management, and we got to see this, and I'm reporting it that we did this splenectomy and the patient recovered. So if you have a similar condition, you can opt for this way because you have no other option. Yeah, you can ask your question. Yeah, someone is raising the hands. If you have any question, you can ask this. Okay, no questions. Okay, so this is the case report. Now we have the case series, guys. So I'm telling you now about the case series. So what is a case report? Case report is actually about the unique diagnosis, rare management of a single patient. And then case series is about multiple patients and the same diagnosis, and you follow them and you report them. Like there are, for example, 10 patients of pneumonia who are reporting to the hospital, and they have like the same different unique presentation or something like that, so you can report them. So case series is actually is an accumulation of like case reports who are actually similar. How to submit it? I will guide you about everything. Just stay in touch with me. I'm giving you a basic idea of the research pyramid. It is very important that you guys know this. Then we will go and we will find the topics and we will do everything. Okay. So this is actually the case report, the case series. Then you have the Iftikhar already explained these, but you guys do not need to know this as of now. So I'll just skip this. Okay. And then you have the randomized control trials. You guys cannot do these so right now. So just skip it for now. Okay. Then you have the systematic reviews and the meta-analysis. So nowadays the trend is that do systematic reviews and the meta-analysis. So they are like on the evidence based, you have like different types of evidence, the strong evidence and the weak evidence. So right here in the research pyramid, you have the weakest evidence, and here you have the strongest evidence. So if like I'm searching for a drug which works the best in, for example, like name a disease, so it works, which drugs works best in this disease, for example ABC disease. So I've the strongest evidence that I can find is the systematic review and the meta-analysis. So this is a very good thing to learn. This is a very good thing to learn. You should learn this, but initially you should learn the basics. You should learn how to do a literature review. You should learn how to do the scientific writing, how to search the PubMed. That's why I always emphasize this. Now I will go through your questions. Okay, about the LT writing, we have a webinar recorded on this, and you can watch that as well. And I will also show you again right now. Okay, uh, okay. So this is a very good question that the Troob is asking. So you should like publish at least 3 to 4 LTs or critiques. Okay. So when you publish this, then you ask for collaborations in the group. Why we have like met the groups. We have like around 15,000 people, and you send a text. One thing, a very secret I'm telling you about like research. You know what? In this field you can get like 1,000 people who are looking for work, but not 5 people who are providing the work. So you have like two separate categories, niches where you can apply. So be mature and do go wisely. Okay. So if you're the person who is providing the job, so you'll get like a lot of opportunities. Okay. So learn the skills and provide the things. Be the leader, take the initiative, find a topic, and ask people, come and write with me. They will come, they will write with you. You will get your work done in 1 to 2 hours. You will publish them, and you'll find a lot of people. Okay, I'm going to tell you. So this was a secret that I was telling you guys. Narrative review as a beginner, yes, you can go for a narrative. You can even go for a systematic review as a beginner, but we will never advise you to do that. Okay, because you'll get disheartened. That's why we do not want you to get disheartened. Okay, so that's why like narrative review also takes a lot of time to get published, and this is the simplest way. That's why we are telling you guys to go for the LT, go for the critique, and then come like what I will tell you: publish 3 to 4 LTs, come back to the group, find a narrative review topic, and then ask for collaborators, get 5 to 10 people with yourself, and go for the narrative review. Then, so that's my take on that. Okay. Okay. Most our publications be relevant to our future field in which we apply? No, absolutely not, Arisha. Right now, I don't know in which year you are. Okay, you're in the second year of medical school. So, no, absolutely not. In second year, you should not specify your field, okay? You should publish on literally everything. Then, when you go to like final year, you can just narrow it down to your field of interest. So, you should absolutely not narrow it down right now. You should go for whatever you find. I'm working on ophthalmology right now. I do not want to go to ophthalmology. I'm working on surgery topics. I do not want to go to surgery. So you do not necessarily need to narrow it down. Okay. How will you we learn the very basics? Any guidance like where we can learn the critique? Mohammad Idris, we have a webinar recorded on this, and we constantly send messages into our groups to guide you guys. I believe that you guys are reading those messages, right? I'm absolutely telling you. I'll tell you again. Uh, go to our YouTube channel, watch the video. If you do not get the message, come back to the group, ask the question. We will answer you again. Okay. So. That's the thing. Okay, I'll show you right now how to do that. Okay. Okay, we will send it to you in the group. You can ask in the group. Okay, we will. It is on a YouTube channel. You can just search International Research Community and you'll find our channel. Okay. Explain again how to find a research topic. Okay, now come to that point because we are getting a lot of questions about this. Can you guys see my screen?
Yes, yes.
Can you guys confirm this?
Yes, yes, clearly.
Okay, thank you so much. And if you have any questions, stay with us. We will answer all of your queries. Okay. Okay. So we are here. like you should know, okay, you should know how to do like the search on PubMed. This is very necessary. If you go to like the advanced search on PubMed, you see you can like find the authors, you can find like the affiliations. Like if you are like a USMLE aspirant and you want to apply for observerships or electives, you can literally find the email of any professor from this PubMed. So you should learn these tricks, no? These are very basics. Like I want to tell you, for example, I want to search like as if the heart told you. I'm going to show you guys a video. Okay, YouTube. Okay, we come here, we ask it PubMed search tutorial. Okay, can you guys see my screen? You see here, like this is a very good video. Okay, look here, you have this video, then you have like a lot of these videos, how to search on PubMed. You see here how to search on PubMed, how to search on PubMed. You can, if you like long videos, you can just say over 20 minutes. So can you see this? Like you have this 46 minutes video. Okay, so you can just go there and you can watch all of these videos, and you'll learn like all of these things are freely accessible on YouTube. Okay, can we get Scopus access free? I don't know what question are you asking about. You should stick to the PubMed right now. If you do not have access to Scopus, you can ask in the group. There are people in the group who have access to Scopus, but you do not know the others who are just on the basic side. Please skip the Scopus and other things right now. So what I was telling you guys, you can simply see like these are these videos. You can just go and write there. I'll just give you a basic idea how to write. Okay, I'll find a topic and then we will write something on it. Okay, together. Okay, so this is like Lancet. I do not want to write something on Lancet because Lancet is a very high impact journal, and obviously I'll get rejected. So this is like a journal. You can get the idea. Like this is the name of the article. These are like the names of the authors. This is the name of the journal. You can see this. This is the name of the journal, and this is the date at which it is published. This is the DOI. I will tell you what is DOI. Like we have NIC, National Identification Number of each one of us, which is separate for each individual. Similarly, a digital article has a DOI, which is completely different for each and every article in the whole world. These are like the publications dates, the PubMed ID, and everything. So this is the name, the authors, the name of the journal, and the publication date. Okay, so you can see the impact factor. The impact factor. Do you guys know what is impact factor? Okay. So what about the others? Do you guys know what is impact factor? Okay, Usman knows it. Fatma does not know it. Okay, for those who know it, it's very good. It's very good. And for those who don't know, let me tell you some basics about the journal metrics. Okay, so let's see here. This is a journal, and this is the publisher. Like there are a lot of journals associated with a publisher, so we have different types of publishers like the Science Direct, the Willy, the Springer. So this is not the journal name. Okay, people get it mistaken for like the journal name. The journal name is this one. Okay, this is the publisher, this is the journal name, and this tells you about the mood of publishing. There are like several moods of publishing. People ask us about the payment that they will make to publish papers. I have published 30 research papers. I have not paid even a single Pakistani rupees to get my papers published. And that includes case reports and letter to editors and narrative reviews and original research papers. I have not paid a single Pakistani rupees. Okay, so you do not need to pay anything. Okay, but I'll tell you the tricks how to do it. Okay, so this is the name of the journal, and you can see like here you have like the open access. So what there are two types of publishing policies. One is hybrid and is one is open access. In open access, you will have to pay some fee to publish. In hybrid, you can like publish without any fees. So like here you have like the open access article. So it means that if you want to publish in this article, you will have to pay some fee. Okay, I'm giving you a basic. Okay, so what document should we need along with the manuscript while submitting? I'm telling you everything. Okay, how to make this, how to publish article free of cost. I'm telling you the exact same things. So there are two types of publishing policies. Like the journal has to make some money. Okay, one way or another, they will either take the money from the authors or they will either take the money from the readers. So there are two potential sources from where they will take their money, from the authors or from the readers. So if they are taking it from the authors, it means that the readers will not have to pay. So it will be freely accessible for everyone. If they are taking it from the readers, it means that the authors will have to pay. So the open access means that authors have to pay, and for the readers it will be freely available. You see the PDF is available. The PDF is available. Why? Because they are taking the money from the authors. So there are basically two types of publishing. So if you want to publish free of cost in this journal, how will you do it? So the basically you will collaborate with people from low income countries. Okay, so you will collaborate with people from low income countries, and they will be your corresponding authors, and they will submit to these journals. And there's a policy that from low income countries, Pakistan is not in the low income country. So you'll have to pay if you are from Pakistan. You'll have to include someone from like Afghanistan, from Bangladesh, from Africa, and there are a lot of these people in our group. So you can just ask for them, and a lot of people from the developed country as well. So you will include them in your paper, and you'll be able to publish for free. Okay, and the types of the documents that need to be submitted, we'll send you the templates. Okay, you will need to submit like the cover letter. What is a cover letter? A cover letter is a simple thing which tells you the editor about your work, that this is my work, I've written about this is a very unique thing, and kindly consider my publication. So this is just a cover letter. Okay, and one is a title page. What is a title page? A title page simply tells you yes, Iftikhar.
Okay. One thing
Okay,
Saad mentioned about the low income countries.
please, there
Okay,
there is some issue with the sound.
um, guys, am I audible?
Yeah, yeah.
Okay, so one thing Saad mentioned about the article publication charges and the authors from income countries. So there is a thing that you cannot collaborate with anyone from low income country just because they are from low income country and they are your corresponding author and submitting your manuscript and they become author. This is gifted authorship. They have to contribute to your study. Like if you are doing a research, if you are doing a study, simply ask someone in the group that I am doing this study. I need someone from this country to contribute, even to review your manuscript, even to a little, to a fraction of access to your study. But they have to contribute to your study and then submit your study as a corresponding other. And then when the studies get published, there will be no APC charges, but you're also following the ethics guidelines. Like you're not disobeying their ethics, because all the authors that are included in your author list should contribute to your study. That's it. Thank you, guys.
Yes, absolutely. Iftikhar is absolutely right. You should like take care of the ethics, and there are a lot of ethical dilemmas in like publishing. Why all of this research is behind paywalls and everything, but you should take care of these things. Okay, so yeah. So this is like how to publish free of cost. So remember, you do not have to pay a single penny for your research. Okay, so from this webinar, if you learn one thing, you learn this thing, that you do not have to pay a single penny for your research. How? Published closed access hybrid journals. I will show a lot of journals like which are hybrid. Like let me show you. Let me show you this journal. Let's see if this is hybrid. This is a journal by Willy, and let me see if this is hybrid. It's taking some time. But you see this article is openly available, and this article is not available. What does it mean? It means that some of the articles are open access and some of the articles are closed access. It means that this journal is hybrid journal. Okay, there are a lot of journals like they do not clearly, Willie does not clearly write here, but if you check like Heart and Whistles, Heart and Whistles, the Springer clearly writes it there. Here you can see, like here you see this, they say that this is hybrid. It means that you'll have to pay nothing and you'll be able to publish your manuscript. Okay, how do we find people from IRC is all yours. International research community has it, all of these people. Okay, so every time you want to publish, we have to collaborate with such people? No, absolutely not, Sadaf. Like if I'm publishing in Heart and Whistles, why do I have to collaborate with anyone? I'm just submitting it here, and even though my article will not be easily accessible for everyone, like I cannot access this art. This is like, for example, open access. I cannot access this article. You can see, but I do not need. I just want my work published. You see, they're asking me for like 33 euros to see this article. Okay, so you absolutely do not need to collaborate every time with them. Publish in hybrid journals. They will not cost you a single penny, and you can submit it from your account anytime, and they will not ask you for any money. So absolutely not, you do not have to collaborate with them every time. Okay, what is the
Saad, our
ideal?
meeting is ending soon. Saad, our meeting is ending in a minute. So wind
Okay,
it up.
so should we wind it up or should we like go to another meeting? What do you guys say? We have like 30 seconds.
I think, Saad, we should go for another meeting and teach them more about closed access, open access, and hybrid, and why they do not need to pay APC charges because there are a lot of scams about
Okay, guys,
selling all these different.
Thank you for the interest. If Iftikhar, kindly make another link and we'll share it with them in the groups because right now we'll not have the time. So share it with them in the groups and then we talk more about it. Okay, we will be sharing a new link with you guys. Okay, so I'll answer some of the questions. Kino study. Uh, yeah, yeah. Yeah, okay, I'll answer some of the questions briefly. So the question is, can our study get rejected if even if we have paired in the open access journal? So this is a very good question. Like, so there are two types of payment. Like some journals need you to pay some article, like some processing charges. Like if you are submitting to their journal, usually the APC you will have to pay only after your article get accepted. So if it gets rejected, you have to pay nothing. Are you getting my idea? So you have to pay nothing. If your article gets accepted, they will ask you that you have to pay this amount, only then we will publish your paper. But usually if it gets rejected, you do not have to pay anything. Okay, so yes, the journal finder works for the meta abstract as well. To correspondence from the author, for is it compulsory to need correspondence from the author for critique LT? I don't know what does it mean, but critique is something which you write in response to an article. You actually do constructive criticism on the article. You add or subtract something from the discussion of the article. Like if they have missed something, you add it to it. Like you add 2 3 points, 2 3 4 extra points. This is very basic thing. Okay, so do we write LT critique on RCT and systematic review meta-analysis? I would highly recommend to write it on RCT because there are a lot of flaws. Like I usually find it in RCTs, so it's very easy. Okay, so you can also write it on systematic reviews and meta-analysis, but I would never recommend writing it on like narrative reviews and those things. Okay, so and there must be a catch if you are not paying, right? Yes, there is a catch. Your article will not be visible to everyone. You will not be getting the a lot of citations. Okay, but right now as a beginner, you do not need to worry about the citations. You just need to worry about getting your research published. So you should worry about that instead. Sorry, guys. And the next one is elaborate narrative review. So, what is a narrative review? There are two types of reviews. One is a systematic review, and one is a narrative review. So, in a systematic review, you go through a systematic way. As the name implies, there is a systematic way. There is a proper method for that. You follow a specific PICO. What is a PICO? Population, intervention, comparison, outcome, and study design. You actually outline everything, that this will be my population, this heart failure population, drug A versus drug B, population intervention and comparison, and I'll study these outcomes. So this is a systematic approach. In a narrative review, you do not have any systematic approach. Like I also always give people the example, like if they ask me whose biryani is the best in the bazaar, write something on this. So what I will do, I will just go to the bazaar, I will try every biryani, and then I'll come back and I'll write a paper that okay, I tried all the biryanis, one was saltier, one was tasty, one was. So this is everything that I will write about. So this is actually your narrative. The name implies this is your narrative. You write something, it basically has the structure, introduction, then you have the methodology. If you have followed any methodology, then you have the discussion. So this is actually your narrative. This is a brief introduction. Okay. So so do we write a critique on closed access or open access? You can write it on any article, but if it is closed access, so you will not have access to it. So you should ask someone in the group to give you the article, to give you the PDF of that article, and once you get the PDF, you can start writing. Okay, if it is open access, you can just straightforward download it. Okay. So, considering the real world scenarios, should we focus on the quantity of published journals or quality of published journals? Since we cannot find loopholes in the journals via AI. Okay, so the thing is that you do not need to, I think if I'm getting your question right, you're asking about the critique or quantity of, if you're asking about the critique, so you do not necessarily need to comment on their methodology. You can comment on their results. Like if there was a study that was published and they were saying that the amount of inflammation is directly the amount of inflammation and inflammatory bowel disease is directly related to a risk of fracture. So we commented on it that inflammation is a subjective thing and is not an objective thing. So just like this, you can like comment anything on it. It's your take. Okay. And you should, if you are asking about the number of papers, yes, you should have like at least 4 to 5 papers with you, because it will give you opportunities. Like if you are in our community, you see like there are a lot of opportunities coming around, but all of them are seeking for people who at least know the basics. So if you do not know the basics, no one will take you into your project. So if you have like 4 to 5 published articles, you'll have more opportunities coming your way, because at that stage you will be able to collaborate with people. Like if you send me a message that I want to collaborate with you, how can I collaborate with you if you cannot, if you do not know the basics, if you cannot search, if you cannot write something? So initially you have to go and you can like learn these things, and then only then you will be able to collaborate with people. So you should have some papers on your CV. Every type of article has its unique flair and format that sets it apart. Okay. Topic selection. Again, we showed you how topic selection is done. You do not need to do topic selection. Just go, write letter, publication type, go to the journal, find the topic which works for you, and just you do not need to find a journal, because you'll submit it to the journal from which the original article is. Okay. You do not need to search for the journal, guys. Again, I'm here to clarify. Okay, you write an LT on in response to an article. So, for example, you took an article from like Lancet and you want to write something on it. So, you will write something on that article and then you'll submit it again to Lancet. So, you do not need to find the journal. If you took an article from like Heart and Whistle journal, you wrote something on it, you will submit it back to Heart and Whistles. You do not need to find a journal. Okay. Okay, I think I have done it narrative review. Okay, we will show you in the next webinars like what is a narrative review and what is a systematic review. I have given you a brief idea. Okay, so how to select a topic? Again, go to the journal, find any recently published article. The criteria is that the article should be published no more than a month later. Like it should be like, if it is like 10 March now, it should be published after 10th February. So it should be like within 1 month, and that's the criteria. Okay. Do some journals have good or bad reputation, or just we should submit to any one of them? Yes, there are some journals who have good reputation. Reputation. There are some journals who have bad. Like I contributed to a paper, and then the other authors who were on the paper, they wanted to submit it in Curious, but I've heard bad things about the journal, so I just told them to remove my name from the author list. So I did not publish, even though I had contributed to the paper, but I did not publish in Curious because I thought that it would not be good for my reputation. So I just removed my name from that paper. Okay. So yeah, so always look for like PubMed index journals. If the journal is PubMed index, it is usually good. Even though Curious is PubMed index, but there are a lot of questions on it. Okay. So, how to do research? We are talking about this, Arvina. You start from the basics, and then you look at the research pyramid. You like climb the stairs. Okay, you go from LTs to case reports to like narrative reviews to like systematic reviews to meta-analysis to database studies. So this is how you climb the ladder. Okay, difficult for me. Please describe terms like critique and other terms. I think you joined the webinar late. That's why you're not getting the terms. How to find a mentor who will help me write a paper. We will start the mentorship programs from our platform as well. They will be like very affordable. We are starting it very soon. But if you can find someone else as well, you are always allowed to go and collaborate with people. Okay. Okay, PowerCo is used. Yes, it is used for like systematic reviews and meta-analysis. If we are writing a critique on RCT, should we give references from previous RCT? Yes, this is a very good point. Okay, so like if I'm giving references, I do not like if I'm writing an LT and I want to give references. I should not give references of like editorials. I should not give references of case reports. I should use strong references. I told you what is strong evidence. RCT is a strong evidence. Systematic review, meta-analysis is a strong evidence. Even cohort studies, they are good evidence. So you should like give strong references and references which are like from like previously the articles which are published in the past 5 years. If I'm writing a research article in like 2025 and I give a reference of an article which was published in 1995, so does it make sense? Obviously it does not make sense, so it will get rejected. So give references which are like new and obviously okay. Does narrative review is on top of research pyramid? No, narrative review isn't. Narrative review has no scope. Okay, so systematic reviews and meta-analysis they are like on the top of the pyramid and they have like the highest value. Okay, so narrative reviews, it's just my narrative. What I think, I just presented my point of view. It can be right, it can be wrong. It's just a narrative review, so it does not have that much value. How can we access the closed access articles? So obviously you can access it by asking from people in the group who have access. There are people who have like institutional access. Like there are some colleges like the Dove University in Karachi, like in I think King Edward's also has access to some articles. There are some institutions where people have access, so they will share the article with you. From where we can find the references for critique. So obviously, let me show you. I think if the car has shared the screen, so you can find the references. You can do the literature review. That's why I tell you to do the literature review. If the car, are you there? Okay. So you are okay. You're asking me to share. Okay. Should I? Okay. You guys should tell me. Should I go and share the screen or should I answer the questions like this? It's up to you guys. Okay. What about the others? Okay. 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 Sure. We will share the template with you. Okay. Can you guys see my screen? Hi. Can you guys see my screen? Yeah. Okay. Thank you. Thank you. Okay. So, like, I'll go to PubMed here. That's why I tell you to go and watch these videos, guys. I am requesting you go to YouTube. Okay. Go to YouTube. Just go here and write write PubMed cert tutorial, and you'll find these videos. Guys, watch these videos, do it for yourself. You'll do great. Okay, so I'll just give you an idea. Like, if I want to find out who is Saad Khan, and so it and means that you want both of these words. You want to find articles in which both of these words are used. Okay, I want to find Saad Khan from Saidu Medical College. Okay, so you can see, like, you're getting like 15 results. Okay, these are some of my articles. Okay, 30 results. Okay, so you're getting the results. Okay, if you want to write on like alcoholic cirrhosis. Okay, you can just search here. You see, you'll get a lot of articles. Like, you can just change it to like the abstracts. It will show you the abstract, guys. You see here. Okay, I will write an article with you guys. Okay, so you guys get an idea how to do it. If there is any issue, like, okay, let me open Word. Okay, so I'm giving you a brief idea of how to do it. Okay, let's go. So they are talking about cirrhosis. They are taking like cirrhosis of liver is a frequent disease. Okay, this is like, for example, the introduction. So I'll just come here. I will type this. I will say this is the first thing that I want to talk about. So one, I will come down. I will say references. Okay, I'll say references. I'll say my first reference is, I'll just copy this one. I want to give the reference of this article, so I will just open it in